Having a healthy gut can also really support having a healthy vaginal microbiome. And this is really key for fertility. Now, this localized inflammation that was just in the gut can become systemic or throughout our body and affect areas like the ovaries or the vagina or the urinary tract.
How can the gut microbiome affect detoxification and elimination from hormones?
When you're treating someone and you're stuck, they're not getting better, you're trying to figure out why, think about the oral microbiome. Treating the oral microbiome can be one of those things that really moves the needle. So they've actually starting to see in research that the fetal microbiome will resemble mom's oral microbiome.
What about the connection between lipopolysaccharide, or LPS, and infertility?
Your system is under high alert and there's a lot of inflammation and there's infections, or there's just kind of a disarray of your immune system. The first priority is
Hello and welcome back to the Vibrant Wellness Podcast. I'm Dr. Emmy Brown here with my fantastic co-host, Melissa Gentile. Today we have the inspiring Dr. Emily Hernandez, a licensed naturopathic doctor, clinical consultant for biocide and botanicals, and founder of Wildcraft Medicine. Trained as a Lyme literate doctor, Dr. Hernandez spent her first 3 years of practice solely treating Lyme. Through this experience, she gained insight into treating every system in the body. Today, Dr. Emily specializes in preconception health, fertility, digestive disorders, hormonal balancing, and chronic illness. She is an expert in a variety of modalities spanning from detoxification and drainage therapy, botanical medicine, nutrition, and more. Join us today as we discuss the connection between the gut and hormonal health and fertility with Dr. Emily. Dr. Emily, thank you so much for being here. We are so excited to have this conversation.
Thank you so much for having me. I'm excited to chat too.
Awesome. So before we get into the nitty-gritty and talk about hormones, we all know that inflammation, dysbiosis, and poor digestion can be associated with many chronic diseases and conditions. But I'm wondering, why do you think we're seeing more and more GI complaints overall, and especially in younger people? It seems like people of all ages are coming to practitioners now.
Yeah, that's so true. In fact, I'd say the majority of my patients are aged 15 to 35. So yeah, you make a great point, and most of them come in with some sort of GI condition or complaint. I'd say honestly, unfortunately, it's just the toxic world we live in. We are exposed to a lot of things like pesticides, heavy metals, mycotoxins from molds. And as hard as we try to live a healthy lifestyle, if we're kind of focused on that, unfortunately, our soil is still contaminated. Our air quality is still contaminated. So we do the best we can, and it's not to stress anyone out, that we have to live in a bubble necessarily, but we are seeing, I think, a lot more inflammatory states that affect the gut quite a bit.
Absolutely. Yep. That seems to be the consensus. Well, I'm glad we have practitioners like you doing the good work you're doing.
Oh, thanks.
And then another question too, in terms of your training that you started off with, extensive experience treating Lyme. And so in terms of gut health, can you explain how supporting gut health first or alongside Lyme treatment improves outcomes? And this can kind of set the stage for the rest of the conversation in terms of really putting gut at the front and center.
Yeah, I love this question. Thank you for bringing it up. And I think sometimes my Lyme patients, especially when I used to focus on Lyme the first handful of years, were ready to just get Lyme-specific herbs and jump into whether it was antibiotics or antimicrobials right away. And it was kind of like, let's pump the brakes for a second and really look at this as a whole picture, right? Like look at the forest instead of the trees. And the gut is such a foundational piece of our health. It's where most of our immune system is housed. It controls metabolism, and we'll talk a lot about how it interacts with hormones. It can make neurotransmitters and supports mood, all sorts of things. And so I think we have to remember, if we want to get to a state where our body can heal on its own and really kind of keep things under wraps. So with chronic Lyme, I always say we're not necessarily using the word cure, but we're trying to get the bacterial load under a threshold so that the immune system can kind of keep it under control. In order to do that, we have to have a healthy gut, because most of our immune regulation and immune system happens through gut activation. So it's really, really key, as you mentioned, to either start with or make sure that you are incorporating gut health in some sort of capacity when you're treating Lyme or any other kind of chronic illness. This is going to help people tolerate the protocols better. It's going to help them feel better, both physically, mentally, emotionally. And I feel like they are able to get to a state of remission and stay there more successfully when we incorporate gut health.
I definitely want to get into fertility and hormones also, because I know that that's kind of your focus and specialty now.
Yeah.
And we know that the gut is also going to play a massive role here as well. But I do want to pull in a thread that you kind of mentioned earlier is just the prevalence of toxins in our world. So we just live in like the most toxic world right now. I mean, we're just flooded with like heavy metals, pesticides, mold, parabens in cosmetics, cookware, in our air, in our water. It's almost like a full-time job trying to avoid everything nowadays. But what role do these play in our hormonal health and in even fertility?
Yeah, this is a great question. So, most of these things that you just mentioned are endocrine disruptors, right? So, they have the ability either to affect the microbiome, which we'll talk a lot about. I'm sure there's going to be some questions about how the microbiome plays a role in estrogen and other hormone regulation, but they can interfere with that. They can block receptors. They can even activate receptors and kind of create hormone like reactions in the body, even though we're not necessarily having the actual hormones there. They cause inflammation, which can damage things systemically or throughout the body, including things like ovaries, testes, and so forth. So they can lower our ability to make hormones. They can lower our ability to have really quality eggs and quality sperm. So there's so many different ways in which toxins, unfortunately, can affect our reproductive health. And a lot of that is through interfering with gut health as well.
And kind of speaking to these interferences with fertility, are you seeing a lot of patients with really high cortisol levels or almost no cortisol levels? Like I know your website mentions a lot of information about the HPA axis
Yeah.
dysfunction that we're kind of seeing, and I kind of feel like it's an epidemic that's just not really talked about a lot. So can you shed some light on that?
Yeah, this is a great question. So the HPA axis, hypothalamus, pituitary, adrenal, and between the toxins that we just mentioned, our go, go, go kind of lifestyles, lack of sleep, whether there's any issues with diet or exercise or lifestyle in general. Yeah, stress is a huge, huge piece to all this. When we have too much stress, our body initially, either too much, one kind of big trauma, or we have continual stress, our body responds by making cortisol, which has downstream effects. It affects blood sugar. It can affect other sex hormones, including things like thyroid. And after time, we kind of are burning the candle at both ends, right? So the body has a hard time keeping up with the cortisol demands. And then it starts to pull from other hormones in order to make enough cortisol. And one of those main hormones is progesterone. So we often see, for example, low progesterone or kind of progesterone deficiencies, even functional deficiencies in people that have really high stress. And when it comes to fertility, progesterone is one of the main hormones that we need to get and stay pregnant, right? Progesterone, the name itself is gest, meaning gestation, right? Is all about pregnancy. So that's one really big correlation. And again, I mentioned thyroid too. Thyroid has a really big role in fertility, especially in ovulation. T3 is one of the hormones that can stimulate the LH surge, so luteinizing hormone, which is what we see before we have ovulation. So if we don't have enough thyroid hormone, that can affect our ability to ovulate, which obviously is going to affect fertility. And then even when we get pregnant, we want to make sure we have robust amounts of thyroid hormone, or at least balanced levels, because our metabolism goes up in order to support the developing fetus, especially their brain development and neural development. So yeah, stress can greatly affect not only cortisol, right? Because cortisol is our stress hormone, but all these other hormones that talk to each other. We kind of think of it as this kind of triad between the hypothalamus, pituitary, and the brain, and then the adrenals, as well as for me, how the adrenal talks to the thyroid, the ovaries, or the testes. So supporting stress, and that could be physical stress, that could be mental stress, that could be stress from toxins, from dysbiosis, from food sensitivities, things that we are exposed to that our body doesn't do well with. So stress can be a lot of different things, which I know, again, can be overwhelming for people. So it's just about kind of breaking it down and doing the best we can. You don't want to get overly stressed about controlling your stress, because that's just a vicious cycle. And I think we all deal with that, especially I think sometimes practitioners and people that know a lot about this. It's like, man, I know what's going on. And so it's almost more stressful. I know I experienced that myself in my own fertility journey. So yeah, it's just like one day at a time, taking a deep breath. Where is the main focus so that we can kind of tackle one thing at a time? What's standing out the most? And again, that always tends to bring me back to gut health because it has so many different kind of domino effects for other systems.
And actually, Dr. Emily, I was going to ask you, like, what are some of the ways we can kind of get control over this HPA axis dysfunction? But it sounds like stress management is really at the core of it, especially when it has so many downstream effects.
Absolutely. I think even as holistic practitioners, functional medicine practitioners, when patients come to us, they expect supplements, right? Which I absolutely use and they're really helpful. They supplement what we're trying to do. But in reality, the biggest impacts you can make is lifestyle changes. I think anyone, whether it is diet, sleep, exercise, stress management. So those things, again, foundational, should be in place, or working on those things while you're also using supplements and using other means to help optimize the body to get back into balance.
I'm guilty there. You can only take so much rhodiola and ashwagandha. You can't outbalance staying up late and drinking excessive caffeine and all of that. So had to learn that one the hard way.
Yeah, totally. And the supplements do help to balance, right? I mean, if you're just burning the candle but not replenishing it, then it's going to burn faster. So yes, I mean, to answer your question, I do love adrenal and adaptogen herbs. I think those are so critical. So again, kind of right in line with gut health being foundational, adrenal health is so important. Adaptogenic herbs are amazing because they not only work on the adrenals themselves and controlling cortisol, but they really have other effects on supporting the balance of the HPA axis, supporting thyroid function, supporting sex hormones. So sometimes when we look at, for example, labs and I see thyroid is just kind of functionally low, I also like to look at what's happening with the adrenals, because sometimes just supporting the adrenals will help the thyroid work better. And so you don't always want to just treat markers on a lab, although they're very important to help identify what you already think is happening. You want to step back and really understand what's the full picture. How are all these things talking to each other? And where can we make, an impact that's going to have the greatest impact upstream? So adrenals absolutely is one of those areas that we do that.
And before we go into details on hormones and fertility and the gut, Dr. Emily, I'd love to know what inspires you to do this work. How did you get into this? It's kind of niche, especially with the preconception work, which I love. And I think we really need to get the word out on that. How did you get into this?
Yeah, well, as you had mentioned, I started off at a Lyme literate practice and really was only treating Lyme disease, mold, kind of chronic issues. And my heart goes out to all these patients. It's a very, very intense and chronic illness that affects every single system of the body. And so I really learned quite quickly right out of medical school, someone comes in with all these complexities, like where do you start? And a lot of times it went back to get their stress under control and work on their gut. And if we weren't doing those two things, then we saw that it took a lot longer for them to respond to protocols and get better. So I think I just started realizing how important those areas were. I also have always loved pediatrics and I've always wanted to be a mom. I knew that in life that was going to be my most important job on this planet. And I have a 1.5-year-old. So as amazing as it is, also the most difficult job on the planet. But I absolutely love it. And so I wanted to help other men and women get to that place where they were starting or growing their families. And for me, preconception in particular, I mean, fertility, absolutely, but preconception for me just makes so much sense. Like this is where health starts, right? Before we're even conceived. So if we have the healthiest eggs, the healthiest sperm, that's those foundations, we're going to create a little human that's as healthy as possible and hopefully healthy throughout their life. So they don't, we don't have to keep dealing with all these really lifestyle chronic kind of conditions that we're seeing today in younger and younger people. Right. So I just, for me, feel like preconception is a place where I can make a really big impact on society itself.
And speaking of root cause medicine and really getting to the gut to think about root, but speaking to preconception, like you said, even before you're born, if we can work on, especially now with all the toxins, as we mentioned, it's more important now than ever, I think.
Absolutely.
So this is an interesting one. Before we talk about kind of the mechanisms at play between the gut and hormones, we are always talking about the gut microbiome, but what about the reproductive genitourinary tract microbiome?
Yes,
Is there an
awesome.
interaction between the gut microbiome and the reproductive
Yes.
microbiome? And what significance is there in terms of overall health and wellness and fertility?
I love this question. This is great because you're right. So much attention these days is on the gut microbiome, which makes sense because it is the largest microbiome that we have in our body, made up of 100 trillion microbial cells and 2 million microbial genes. I mean, they play a huge role in our health, but the reality is that there's microbiomes all over our body, right? On and in our body, including vaginal, uterine, cervical. I mean, fallopian tubes have their own microbiome. There's even research now showing that the fetus and inside there's amniotic kind of microbiomes. I mean, really, really cool to like learn all this. I'm
Yeah.
still I feel like in general, we're just kind of at the surface of learning about all these. But vaginal, uterine microbiome, very, very important. And there's absolutely a crosstalk. So first I'll say the gut microbiome being in balance is really key. So a term dysbiosis that I'll throw out quite a bit here just basically is a term that means there's an imbalance in that microbiome. And oftentimes it's not necessarily bad bacteria or bad yeast, but it's just an overgrowth, right? And when we have an overgrowth of one thing, we often have a deficiency in another. And then these microbes start to create their own byproducts or metabolites that sometimes are inflammatory or can affect us in a negative way. So when there's dysbiosis, we often see localized inflammation in the gut. A lot of people have probably heard this term. This can lead to leaky gut, right? Where there's a compromise to the gut lining. And now this localized inflammation that was just in the gut can become systemic or throughout our body and affect areas like the ovaries or the vagina or the urinary tract and so forth. And so this body-wide inflammation then can have effects on those microbiomes in those other areas. So one of the biggest things we see with gut dysbiosis is a metabolite called LPS, lipopolysaccharides. They come from gram-negative bacteria. It's the most potent inflammatory mediator that we know of. In fact, they use it in research to stimulate inflammation so that they can then do their research. So just kind of keeping that in mind. And so when we have dysbiosis, we'll often see LPS become systemic, affect different areas, and this can definitely affect vaginal microbiome. So let's talk about the vaginal microbiome for a second. Most of the ecosystem of the vagina is made up of lactobacillus species. And that's really important because the lactobacillus bacteria helps to create lactic acid, which keeps the pH of the vagina at a lower pH, somewhere between ideally 3.5 and 4.5. And the reason this is so important is because it prevents other types of bacteria or yeast from thriving, right? So it really protects us against any infections. Think BV, so bacterial vaginosis, vulvovaginal candidiasis or yeast overgrowth, but even things like STIs, trichomonas, chlamydia, gonorrhea, things like that. And if we have those infections, obviously it can absolutely affect fertility. So having a healthy gut can also really support having a healthy vaginal microbiome. And this is really key for fertility. And then again, of course, same thing with uterine too. I personally don't know as much about the uterine microbiome makeup, but there is a microbiome, a unique combination of bacteria, yeast, viruses, protozoa in each one of these areas. And so keeping them in the right checks and balances is going to help support those organs individually. The other thing about lactobacillus is that there's a really close relationship with estrogen. So estrogen can actually help enhance lactobacillus to thrive in this area. Estrogen can support the vaginal cells to absorb glycogen, which is what those lactobacillus species need to thrive. And so you often see now this estrogen connection, right? So having the right amounts of estrogen to support vaginal health. And again, this we'll see a lot with things like menopause when there's a lack of estrogen, or women that maybe have estrogen dominance. We can start to see imbalances in the vaginal microbiome. So how does this relate back to the gut? Well, because the gut actually can help control estrogen metabolism, and I'm sure we're going to get into that.
Actually, Dr. Emily, you're reading my mind because that was my next question. I was just going to ask, so how can the gut microbiome affect detoxification and elimination from hormones? And if you want to go another direction into different bacteria strands that can affect estrogen levels, please, by all means.
Yeah, no, great question. So there's something called the estrogen that's found in the gut microbiome, and it's specific gut microbes that are responsible for metabolizing estrogens through the production of an enzyme called beta-glucuronidase. So basically what happens is estrogen, I always tell my patients, we want to use the hormones, then lose them, right? We don't want them to recirculate. And yeah, we don't want them to recirculate when we don't need them to, because if they recirculate, that means they're going to bind to receptors and start to cause actions. So use the hormones, then lose them. That's kind of the key. So basically what happens is after we've utilized the estrogen, it goes to the liver and it gets broken down in phase 1 and phase 2 detoxification. And then it gets brought to the gut for phase 3 detoxification. But there is a combination of gut microbes that produce this enzyme called beta-glucuronidase. And beta-glucuronidase can allow for the reabsorption of estrogens and other endocrine disrupting chemicals, sometimes toxins. These microbes deconjugate, so they reactivate these estrogens. Now, in a balanced microbiome, this is actually a beneficial thing. We want there to be some reactivation because we want to keep those estrogen levels circulating in the right amounts. So it's actually a protective mechanism. The body is beautifully innately intelligent, right? But if we have dysbiosis, if we have that imbalance of microbes where we have too many microbes that are producing beta-glucuronidase, well, then what we see is an increase in circulating estrogens. And this can lead to an estrogen dominance. And then the flip side, if we have a dysbiosis where there's a lower abundance of these microbes creating beta-glucuronidase, we actually can see the opposite, where there's a hypoestrogenic state. And there's associations with both of these. So estrogen dominance can often be accompanied by things like PMS, heavy bleeding, cramping, breast tenderness or fibrocystic breast change, but also things like endometriosis, uterine fibroids, endometrial hyperplasia, even things like endometrial cancers and breast cancers that are stimulated by these estrogens, right? So obviously we want to be cautious about how high estrogens get. And I always like to tell people here, estrogen itself is not bad. I think our community often hears about these breast cancers and endometrial cancer, cervical cancers. And yes, we want to be cautious about estrogen stimulating those things. But estrogen itself has a lot of beneficial effects on our body, including immune support, bone health, cardiovascular health, mental health, helps our skin, energy. I mean, so many things. So it's really, again, about the balance of the estrogens, right? And when we have a low state of estrogen, as seen with people that have menopause or just kind of a hypoestrogen state in general, you may be more susceptible to certain infections, especially vaginal infections like BV, UTIs, because we talked about how estrogen really supports the lactobacillus there. But also things like obesity and metabolism can be affected. And of course, things like PCOS, polycystic ovarian syndrome, that is a metabolic condition. And often you'll see a low estrogen state with a higher androgen or testosterone state. So just to give you kind of an idea of what these microbes in the gut are doing to estrogen and how it affects us further. So hopefully that answered your question.
Yeah, definitely a lot to unpack there. So,
Yeah.
but this kind of has me thinking, when you do like a hormone panel on someone, and let's say they have high estrogen or low estrogen, with this information, are you targeting the gut first to see how that affects their hormones? Or do you go in simultaneously with like DIM or something that can help support them hormonally at the same time?
Yeah, great question. It's always a combination for me of the history, right? So the patient actually telling me what have their cycles been like historically, what are their current symptoms, paired with the lab. So I like to look at sex hormones and see. Now, sex hormones for one are extremely, I feel, difficult to interpret because they're constantly fluctuating, right? So we try to measure them at certain times of the cycle so we can get some sort of patterns. And I mean, we can get into this too, but looking at them through blood, urine, and saliva can all tell you slightly different things. But typically I'm doing blood work, getting other markers. So I'll look at hormones through the blood. So I'm looking at that, but I often will run a stool test too and get a sense of what's going on with their gut. So to answer your question, if they're having estrogen dominant symptoms, but their overall estrogen circulating seem low, then I may just work specifically on the gut versus adding in DIM, because DIM itself, which can help metabolize estrogens, works on the gut, but it also works on the liver. And we'll see sometimes that circulating estrogens can come down with using DIM. But for example, calcium D-glucarate really works more on the gut level. So that may be something that I would use for a female that has estrogen dominant symptoms, but doesn't really have high levels of estrogen, at least that we can tell from labs. I'll work more on the gut. Calcium D-glucarate is a great option, but then of course, working on if there's any dysbiosis and controlling that is hugely helpful to get that estrogen back in balance.
Okay, so it's kind of like a balance between both there, depending.
Yep. Yep.
Okay.
And then, of course, every individual is going to they need some thyroid support or adrenal support. We may be adding that in as well. But I would say for whether someone has estrogen dominance or estrogen deficiency, gut is kind of always part of the protocol because we want to make sure that the microbes there are helping to control that metabolism in a balanced way.
And so many of us we like to push it off because balancing the gut can be a process. So we like to think that we can just take a few supplements and balance our hormones naturally, quickly. But it's definitely at the root of it all.
I think so. And there are times where someone comes to me, they've already worked on their gut or they really don't have much gut symptoms. It's rare, I would say. And we just focus on hormones and things get better. But typically when we do that, I will tell you, that they come back and say, you know what, my gut actually does feel better. Like I didn't think I had symptoms before, but now my bowel movements are more regular. I was having a little bit of bloating. I didn't realize, and now it feels better. So it's important to note that there's a bi-directional kind of communication between hormones and the gut. The hormones can also influence the microbial diversity and abundance. So, working on both, I think, is a great way to get them both in balance, but sometimes you just work on one and the other one gets better.
And what about the connection between, you mentioned lipopolysaccharide or LPS, Dr. Emily, and infertility? I know personally there's some research into endometriosis and dysbiosis, for example.
Yes, absolutely. And I would say in general, dysbiosis can lead to downstream effects where there's just general immune dysregulation and can lead to things like autoimmune conditions that can drastically affect fertility. When the immune system is not working properly, and again, I always tell my patients this, your system is kind of under high alert and there's a lot of inflammation and there's infections or there's just kind of a disarray of your immune system. The first priority is like getting your system back to balance versus trying to also nourish and create life and support a growing fetus. So the body is innately intelligent and says, whoa, fertility is the first thing that goes to the wayside. We have to focus on this system first. So it's good to think about it like that because people are sometimes don't realize, me being in a really healthy state is not only going to help create a healthy baby, but also help just get pregnant and stay pregnant. So yes, LPS being an extremely inflammatory triggering metabolite can lead to not only gut issues, but we see things like a huge connection with things like brain cognition, even things like Alzheimer's down the road, obviously. It can affect things like uterine lining, uterine health, endometriosis, any endometriosis at the end, inflammation, right? Anything that's inflammatory. LPS is just one of those biggest triggers for inflammation. So yeah, working on controlling that is going to allow for the immune system to come back into balance. It's going to help support that balance of the gut microbes and then upstream support hormone balancing so that people can get pregnant and stay pregnant.
And when it comes to LPS or even just dysbiosis in general, what botanicals do you like to use for the management of these microbiome imbalances? And what kind of duration do you recommend? Because I know some people might take this as like, I can just stay on berberine forever. I can be on oregano forever. What does that kind of look like?
Yeah, that's a great point. Well, I'll first say I'm a little bit biased because I do tend to use biocidin quite a bit. I work for the company too, and I've kind of naturally came to work for them. But I've been using them for 10 years in my practice. And the reason I'm bringing it up, because you brought up berberine, you brought up a few other herbs. The reason I like biocidin is that it's a combination of 18 different herbs and essential oils that have multiple different kind of mechanisms of action. And so they have the ability to balance the microbes and work on different types of microbial overgrowth. They can address things called biofilm, which is a sticky mucus that bacteria and yeast and even viruses produce to hide behind. And that can be very hard to penetrate through and get to kind of resolving the issue when there's biofilm involved. And then these herbs also have immune regulating or immune balancing support. They have inflammation support. So to me, it's just really easy to use a formula that kind of does a lot at once. And because there's so many herbs in it, because there is some, herbs that have berberine, and there is some, garlic and some noni and a few other herbs, and they're really potent herbs, but because there's so many in the formula, each herb individually is low dose. And it's the synergistic effect of all of them that really helps to balance and make things work. So typically, I think it's still worth it to be on a protocol for at least 3 months, and then I reassess. It's kind of my rule of thumb, because it does take some time to get through all the biofilm to help support the balance. Most people didn't get sick overnight through lifestyle and whatnot. They've had issues. So it's going to take a little bit of time to heal and get things back into balance. But I think it's good to reassess. 3 months is a good time period. Do we need to add anything else? Do we need to switch up what we're doing? Or, hey, maybe the person's feeling better. We can start backing off things.
And are you doing any probiotics along with that at the same time? Maybe not like in the same moment during the protocol. Like maybe you don't take them in the same at 8 a.m. You take one of them and maybe you take one later on. How do you kind of navigate that? Or do you wait till the end of 3 months to start reintroducing?
Yeah, great question. So I like to do a protocol that looks at multiple different, so like the 4 R's, the 5 R's, right? Remove, inoculate, repair, all that. I think doing it simultaneously is really important, and people notice improvements better. Like I know there's some schools of thought, like don't heal the gut lining before you deal with the dysbiosis, because you don't want to like lock in. I personally don't think it works that way. And I've seen clinically that people do a really great job when we get those. So I typically will do an order where I do always add a binder. So we have one called GI Detox Plus. It's a broad spectrum binder, because what happens is when we start to go after any kind of overgrowth, they can release their own toxins that can make people feel worse before they feel better. We call it die-off or a Herxheimer reaction. So I like the binders in there because they're kind of helping to mitigate any die-off, but they're also mopping up all the other toxins we talked about that we're exposed to, heavy metals and pesticides and phthalates and things coming from our health and beauty products that we're using. So I get the binders in there first. That will help control some of the inflammation and toxin levels. I add in a gut lining support. Biocidin recently came out with one called GI Intercom that I love, because it actually has glycine instead of glutamine. Glycine is an amino acid like glutamine. And although glutamine is really great for feeling tight junctions, it has the potential to be excitatory to the nervous system and potentially irritating. So a lot of people with gut issues, they're already anxious. They're stuck in that sympathetic dominant kind of state. So the glycine is great because glycine is an amino acid that's important for protein synthesis and connective tissue repair, but it also supports calming the nervous system. It supports mood, it supports sleep. So we get people into that parasympathetic state, and it helps them feel better. So besides the glycine, it has things like DGL and quercetin and zinc carnosine. So I like to add that in right away. And people notice very quickly, wow, my stomach feels better. I feel more relaxed. I don't feel as like an anxious stomach. I don't have the bloating as much. And then yes, to probiotics, I like to put them into the protocol right away. I use a spore-based one called ProFlora 4R. And the spores are great because they're really resilient. They're very well tolerated, SIBO safe. It has some quercetin and some marshmallow and aloe in it as well. So it's just one a day, really easy to take. And yes, to your point, I do try to separate it at least from the biocidin that has the herbs that are more microbial, that are balancing the microbes. So, at least by a few hours. And then I add the biocidin. So it's kind of this like support the vitality and calm down the inflammation first. And by first, I just mean like even a few days ahead of time, I start these things. So I'll maybe start the GI Detox first. A few days later, start the gut lining support, the probiotics, and then finally with the biocidin. And I always like to say low and slow. It's good to listen to your body. There can be die-off even when you have all these other things in place. So it's good to let your body just slowly acclimate to the herbs that you're using. So that's typically my protocol.
And I have to ask about diet changes too.
Yes.
Because I know we haven't touched on that yet. What do you advocate for?
It depends. It really depends. Again, I try to individualize things as much as possible. If someone has SIBO, small intestinal bacterial overgrowth, we'll talk about FODMAPs, or at least playing around with some of the foods that tend to be big, exacerbate that type of condition. We may remove things that are, if there's like an overgrowth of yeast, the yeast itself, the vinegars, the sugar, obviously. I mean, I'd say the big ones are processed sugar, inflammatory foods. I do talk about gluten and dairy with people. I try to meet people where they're at. I feel like, again, when it comes back to the stress, I know there's some practitioners like, I won't work with you unless you become gluten-free. And I do get it because gluten often can be inflammatory for people, and just the glyphosates that are part of that grain can really affect the gut. But I find that if we can meet people where they're at, they're more receptive and they tend to get on board more easily. Some people need that like all or none kind of, hey, take all this out and focus on this. And if that's the case, I'll do that for them. But most of the time it's like, well, let's start with the big inflammatory foods and start backing those off. But then I'd say more importantly, let's focus on what to include in your diet. So fiber to me is a superfood, right? I mean, the only time you have to be cautious about that is with SIBO. Fibers in the beginning can really make their symptoms worse. So you have to be careful about what types of fibers and how much they're eating. So we definitely talk about that. But fiber is so key for feeding the microbiome and allowing them to produce really important metabolites like short chain fatty acids, for example. And so fiber is huge. We talk a lot about getting enough fiber and the types of fibers in their diet.
And what are some things that you think just kind of like as a society or even in this field that we're really ignoring when it comes to our gut health? Like what would you like to see gain some traction or attention in this space?
Great question. I would say focusing on oral health. I am not trained as a dentist. I am a naturopath, and we learn in school, ask about amalgams, ask about cavities, and that's kind of it. But we know that the gut starts with the mouth. And when we have the oral microbiome, also is probably the second largest microbiome after the gut, and of course is connected, right? And so if there's dysbiosis in the oral cavity, we often see translocation through swallowing into the gut. We see translocation through a shift from the gum tissue to capillaries that are close by, and that gets into our blood circulation. And then we see those dysbiotic microbes and LPS go to the brain, the heart, the lungs very easily. And so sometimes when you're treating someone and you're stuck, they're not getting better, you're trying to figure out why, think about the oral microbiome. Treating the oral microbiome can be one of those things that really moves the needle and helps support their gut, helps support their energy. Especially, I'll give a few examples, like Lyme patients, they often have spirochetes that are in their gums. And I've had a few patients where we've worked for, months, and we can't seem to get past a certain point. And then they go to the dentist, they ran an oral microbiome test or whatever, and we started addressing their oral microbiome, and all of a sudden they're getting better again. So
Wild.
I think oral health is huge, and we're not paying enough attention to it. The other really cool thing with oral health that I kind of recently learned when it comes to fertility, and this is really huge for fertility. When we become pregnant, we have something called leaky gums that happens naturally.
Oh, no.
I know. But again, it's by design, right? So this is how beautiful the system work, our systems work. We get leaky gums, which can lead to more susceptibilities to gingivitis and periodontitis. And you do want to be a little bit more on top of your oral health during that time. In fact, insurance will often cover additional visits to the dentist when you're pregnant. So make sure you ask if you're pregnant. But what happens is the oral microbiome shifts and starts to flourish and expose the fetus to a microbiome. So they've actually starting to see in research that the fetal microbiome will resemble mom's oral microbiome, which I think is so fascinating. So we once thought that it was kind of a germ-free area, and then the first exposure to microbes was through the vaginal canal or through skin if it was a C-section. But they're actually starting to see that now there are some microbes that are starting to support the fetus through the mom's oral cavity. So wow, just like mind blown. Really important to work on your oral microbiome before you get pregnant and keep up that oral hygiene and oral health while you're pregnant.
Yeah, that's really not something that I would have made that correlation or connection. I was kind of surprised when you said that first thing.
Yeah. So was I. I have a lot more respect now for, not always respected dentists, but I have everything they say. I'm like, yep, I'm going to change my toothbrush bristle every 2 to 3 months because biofilm grows on there, and get my teeth clean, like stay on top of your cleaning. It's not just mom nagging you to like keep up with it. It's really, really important. So much research with the connection of certain microbes in the mouth, like Porphyromonas gingivalis and Alzheimer's, higher risk for diabetes when there's oral dysbiosis. That's a whole other tangent. I'm sure we could have a whole podcast just talking about that. But one of the ways that I will support oral microbiome is through herbs that again, balance. So Biocidin actually has a toothpaste called Dental Cidin, and it has biocidin in the toothpaste. So that's one great way to kind of work on biofilm, which is plaque on the teeth and the gums. And again, one of the reasons why this is so important is because teeth are non-shedding surfaces. So these microbes can hold on and create biofilm very easily. So we want to make sure that we're keeping up with it. And that's why brushing your teeth twice a day and flossing is so important, to disturb those biofilm. We also have an oral rinse. It's called Dentalcidin LS. You can rinse your mouth with that after you brush your teeth if you want to get more to the gums. It's liposomal, so it can kind of get deeper into the gums. And we even just came out with an oral probiotic now called Dental Flora. So specific probiotic that you let dissolve in your mouth to repopulate the microbes in the mouth. I mean, just so cool. So interesting.
Very cool. What, Dr. Emily, the Dentalcidin product, that the toothpaste, as opposed to the oral Biocidin product, is that something that's generally recommended to be used continuously?
Great question. We are doing some case studies and research internally at Biocidin to understand what is a good length of time to suggest. Therapeutically speaking, we suggest about 4 to 8 weeks to see the best therapeutic results. But long term, we still are slightly unclear. So that's why we're doing some studies currently. So hopefully that will be out soon. But I will say I've had some patients after the 8 weeks or even 12 weeks of doing it regularly, especially if they have oral issues. They may go to just using it once a day versus twice a day, or just use it a few times a week, and notice that my teeth don't feel as fuzzy in the morning. My breath seems better. I'm not having as many, my dentist is not noticing as much bleeding or receding gums when I go there. So I think it's okay to keep up, but it's always good to rotate and take breaks off of things too.
Right. Yeah. What about oil pulling? What do you think about that?
Yeah, I think oil pulling is great. And that's why I like our Dentalcidin LS, because it's basically an oil pulling with the herbs that also support balancing the microbiome. But oil pulling with just coconut oil can be very soothing to the gums. It can help pull out any toxins. Coconut oil itself has some antiviral properties. So yeah, I think that's a great idea. I know people swear by tongue brushing. So there's a lot of things that you can do to kind of work on oral health.
Who knew it had such a connection with our gut microbiome and our hormones and fertility and all these things? I've heard that, I don't know if you have any opinions on wisdom tooth extractions and how we can have these deep embedded infections and just have no idea about it for years. Is that, and I know we're coming up on the hour here, but is that something that you're seeing often too, or have patients screened for?
Yeah, that's a great question. I don't personally screen people for that, but I mean, I can speak personally. I had to get my wisdom teeth removed 3 weeks before my wedding because I was starting to get, I had never had issues with them. They were fully in. I was like, great. I'm one of those people that just doesn't have to worry about this. And then of course I started getting just some pains and irritation, gingivitis around those teeth. And so I did get them extracted. And of course they want to give you antibiotics, and I understand why. But I decided to just use the Dentalcidin toothpaste, the Dentalcidin LS, and it healed so quickly, so fast. I remember the orthodontist was like, "What are you doing? Because you're only 3 days out post-op, and you look like you're 6 or 7 days post-op." And I was like, "Oh, it's these products." But they're really soothing to the gums too, and they control the microbes. So that's what I personally did. But yeah, I mean, even things like root canals and stuff, all those potentials for infections under the gum, we have to be at least asking patients, I think, about their oral history so we can get a better idea of how much that may be contributing to their health concerns.
Yeah, that's really a whole nother world that I feel like it's just not talked about enough. I'm starting to see it kind of come into our space, but I'm really glad that practitioners like yourself are kind of bringing this to light a little bit more.
Yeah.
But Dr. Emily, thank you so much for coming on the podcast today and sharing so much of your expertise with us. I feel like this is such a great episode to just kind of open our eyes up to so many things that affect our gut microbiome and hormones, and just kind of the correlation between these things and fertility, and the fact that it's kind of an empowering episode knowing that we can take control of all of this. And before we close, I do like to ask all of our practitioners to kind of share, where can we find you so that listeners can connect with you further?
Yeah, absolutely. My practice is called Wildcraft Medicine. So you can find me on my website, wildcraftmedicine.com. I have an Instagram that's just Wildcraft Medicine. Those are the two best places to find me.
Awesome. We'll be sure to link those down in the show notes as well. So if anyone tuning in today wants to connect with Dr. Emily, find her online, we'll leave those below. And until next time, wishing us all vibrant health and wellness.
Thank you so much for being here today. Don't forget to leave us a review and subscribe so we can continue to pay it forward together. And remember, the key to longevity is knowledge. Keep learning, growing, and tuning in to the Vibrant Wellness podcast to discover the latest insights and strategies for optimal health. Join us again next week. Just a reminder, this podcast is for educational and informational purposes and is not a substitute for professional medical advice, diagnosis, or treatment. The views expressed by guest and host are their own and do not necessarily reflect the official policy of Vibrant Wellness. As always, consult your healthcare provider before applying any recommendations that you heard here today.